Just want to do a quick video here about the difference between enteral and parenteral medications, just to kind of help clear it up in case you see it on a test or something like that, just to know the difference between the two. So an enteral medication might also be called like an alimentary medication. It's going to be any type of medication that you give that's going to be absorbed through the GI tract. So whether it's given something orally, rectally, a feeding tube, sublingually, any of those things is going to be considered an enteral medication. So they aren't used a whole lot in the pre-hospital setting. Aspirin is something that we might give, or oral glucose. We don't really give very many suppositories, but we do use it some, just not real often. And one thing to keep in mind with enteral medications is they're a little bit less reliable on predicting how they're going to be absorbed and how quickly they're going to be absorbed, because there's a lot of different things that can affect that. How much saliva production you have, how much mucus, how much gastric motility you've got going on, how much stomach acid there is. All those different things might affect how quickly that medication is absorbed. Parenteral, on the other hand, is something we use quite often. That's going to be anything that we give that's not through the GI tract. So whether we do it intravenous, intraosseous, intramuscular, subcutaneous, even intradermal, any of those routes that we give a medication is going to be a parenteral medication. It's the way we do most things in EMS. It's kind of our preferred route. It's relatively reliable. Something you might keep in mind, especially with like subcutaneous or IM injections, is if patient has a cold extremity and has a lot of vasoconstriction going on in that extremity, and then you give a medication there, it might take longer to be absorbed. But for the most part, it is a fairly reliable source or route to give a medication. So there's a higher risk involved with that, of course. So anytime you give an injection, there is going to be that risk of a needle stick. And also because you are poking something into the patient and through the skin and bypassing that route of protection, there's an increased risk for infection for the patient. So just something to keep in mind in case this comes up on a test or something like that. Just the difference between enteral and parenteral.